Hello, everyone, and welcome to this emergency summit organised on behalf of 122 scientists from the UK and across the world. Today, we've published a letter in the Lancet outlining grave concerns about the UK government's plans to end all restrictions on the 19th of July, even as cases are rising here exponentially. Sajid Javid, the Minister for Health, has said that he expects that we will soon see 100,000 cases a day. The scientists and doctors gathered here today have come together at extremely short notice to produce this letter, in which they say the government is undertaking a dangerous and unethical experiment. We'll be hearing first from a few of the scientists and then taking questions from the press and also asking a number of MPs who've joined us to respond to what they've heard. And we're also hoping to bring in some members of the public as well and some other groups. So thank you all for joining us. And first, we're going to start with some brief remarks from Professor Trish Greenhalgh, Professor of Primary Care Health Sciences at the University of Cambridge, who is going to explain the letter and also why this group has come together today. Thank you, Trish. Over to you.
Thanks very much, Alice. Actually, I'm from Oxford, but I'll forgive you for that. Yeah, as you say, we've called this summit to express our concerns as both scientists and doctors about these plans to roll back almost all mandatory measures to control the spread of COVID-19 from the 19th of July, what's being called Freedom Day. Now, some of the things I'm most concerned about include the abolition of mandatory masking in public places, the abolition of physical distancing, the removal of crowd controls in places like pubs and cinemas and stadiums, and more generally, this encouragement to go about our lives as if the pandemic were over. And as Alice has said, it's not over. The UK currently has the fourth highest number of daily cases in the entire world. We are up there with Brazil, with India, with Indonesia. Yes, many people in the UK are now vaccinated. Yes, the link between infection and serious illness has been weakened, but no, that link has not been broken. There's currently hundreds of people in hospital, and some of those are vaccinated people. And let's remember that half the entire population of the UK, 1/3 of adults in the UK are not yet fully vaccinated. So these vaccination figures are going to rise. The campaign's still going on, so why the rush to open up before many of us are protected? Now, we need to factor in the mechanism by which COVID-19 spreads. There's now strong scientific evidence that this happens mainly through the air. Little tiny particles containing the virus get exhaled by one person and then they get inhaled by other people. And this happens mostly, as you'd expect, when people are in close contact. So when you're close enough to smell the garlic on someone's breath, that means you are breathing in air that has just been in their mouth and their nose. The more time people spend indoors, the more of these infectious particles are going to accumulate, and they will eventually spread throughout a whole room, infecting people even beyond 2 meters. Just a tiny word on masks. They're not 100% effective at stopping the virus, but if you're wearing a good, well-fitting mask, that will filter out between 60 and 90% of these viral particles. And that means that if you're wearing a mask and I'm wearing a mask, we're both doubly protected. So all this means that the best way to reduce the transmission of this virus is first, spend as little time as possible indoors sharing air with people. Second, if you must put people together indoors, keep them 2 meters apart. Thirdly, make sure that people indoors are wearing well-fitting masks. And fourthly, make sure those indoor spaces are well ventilated and that that the air is filtered. Now, let's just go back to Freedom Day before I hand back. The best way to increase transmission of COVID-19 would be to abolish physical distancing rules, to abandon the wearing of masks in indoor spaces such as offices, factories, school classrooms, cinemas, shops, public transport, and also to encourage people to gather indoors in underventilated spaces for prolonged periods of time. In other words, this new government policy seems designed to increase cases. Now, what I predict is going to happen is we are going to get hundreds of super spreader events caused by people gathering unmasked in indoor spaces. And we know that these super spreader events are the main driver of this pandemic. So let me hand back to the chair, and I hope I persuaded you that this isn't a very good policy.
Thank you very much. So that was Professor Trish Greenhalgh from Oxford University. And now we're going to hear a few words from Dr. Richard Horton, who is the editor-in-chief of the Lancet, who published the letter today. Richard.
Thanks very much, Alice, and good morning, everybody. As the World Health Organization's Director General, Dr. Tedros, said yesterday, worldwide coronavirus variants are currently winning the race against vaccines, and that threatens the global economic recovery. Dr. Tedros said that, of course, as an appalling milestone of 4 million deaths was passed worldwide, and that even that exceptional number is an underestimate. It's far more likely to be more than double that figure. I'd like to put the United Kingdom in context, if I can, because we can't think of ourselves as simply an island cut off from the pandemic in the rest of the world. Across Europe right now, the Delta variant is surging in several nations, including here, of course, despite low seasonality and despite rising vaccination numbers. And globally, transmission is increasing in a large number of locations, again, also driven mostly by the Delta variant. These surges are taking place because of premature relaxation of mandates, or as Mike Ryan, head of emergencies at WHO, said yesterday, because of epidemiological stupidity. And the specific concern is that there is a considerable escape of the Delta variant from immunity derived from past infection and even from vaccination. Now, in the United Kingdom, currently, we are at around 128,000 deaths, although again, that's an underestimate. But the Institute of Health Metrics and Evaluation predicts that by October the 1st, there will be over an additional 10,000 deaths. In other words, we are at a very dangerous moment in this pandemic. So let's not be epidemiologically stupid. Our priorities should be first, scale up vaccination coverage, aiming for well above 70%. No country is yet at this level of double vaccination. Malta is 68%, Iceland 62%, even Israel at 57%. We are at 51%, with vaccination rates falling among the young. The NHS has done an absolutely incredible job in our vaccination program, but we need to do more, much more. Second, we need to continue, as Tony Fauci has recommended, mask use and physical distancing, even among those who have been vaccinated. If we don't do this, if we continue with the plan to lift mandates on July the 19th, it will not be freedom that we win. It will be a self-inflicted wound of uncontrolled transmission of the Delta variant that the Prime Minister refuses to even acknowledge, let alone accept. With more cases of infection, more hospitalizations, and more long COVID. And just pause for a moment to consider long COVID, please. It's important to remember that young people are more likely to become sick than to die from COVID-19. As many as 1 in 20 to 1 in 10 people have ongoing symptoms 3 months after a positive COVID test. And if we reach 100,000 infections per day, as Sajid Javid has predicted, that means 10,000 people each day with long COVID. The Office for National Statistics has already reported over 1 million people in April in the United Kingdom living with COVID-19, especially affecting those in the most socially and economically deprived parts of the country and among those with existing disabilities. So the key point is that the medium to long-term impact of COVID-19 is being seriously underestimated by counting only deaths. And of course, if we continue with July 19th, we will create enhanced conditions for the emergence of new variants, such as the Lambda variant that's currently a variant of interest. So to conclude, the overriding lesson from countries worldwide is that those who claim victory too easily will fail. And the government's plans currently defy all that we know about the science of coronavirus. It's as if the government believes that living with this virus means ignoring it or pretending that it does not exist. And only today we have heard warnings from the NHS Confederation and NHS providers about the current and future unsustainable pressures on the NHS. And so ministers will create substantial morbidity and mortality among families that have already endured the complacency of politicians if they continue with the plan that Boris Johnson set out earlier this week. It's a plan that is driven more by libertarian ideology than a prudent interpretation of the data. And so we were very pleased to publish this letter today. Thank you.
Thank you very much indeed for that, Richard. And next we have Dr. Kailash Chand, the Honorary Vice President of the British Medical Association. Kailash, over to you. Oh, Kailash, I think you're muted. If you could unmute and start again. Thank you very much.
Thank you again. I'm Honorary Vice President of BMA, but opinions here expressing are my personal opinions. We all enjoying Euro Cup semi-final last night. So let me remind Boris Johnson that he is no Gareth Southgate. His captain, Matt Hancock, we all know, has scored more own goals than the total goals scored by England in European Cup. We all know we are in a surging third wave of UK pandemic and cases are rapidly increasing. I don't subscribe to his so-called science to let the virus rip loose through community to give us immunity. While our Prime Minister has claimed that the link between cases and hospitalization has broken, this is not the case. This link has weakened, but hospitalizations are clearly rising, with almost 400 people being admitted to hospital daily, an increase of 45% on previous week. In the healthcare service, we have watched in shock while our government has decided to completely lift restriction, knowing fully well that this will very likely lead to record-breaking cases numbers and our hospital will yet again be strained by COVID-19. How can they do this? The NHS entered the pandemic chronically underfunded and understaffed. Over the last 18 months, it has been devastated by 2 waves of pandemic and the fallout from these situations. NHS staff have been left exposed and unprotected. Their concerns have been repeatedly ignored. Many are suffering from unspeakable trauma from what they have had to manage and witness in last 2 waves. There are huge backlogs and millions of patients are waiting for routine care. There are many who will be suffering the consequences of having the COVID-19. Friends, the government has still not learned lessons from its many mistakes, and it's not taking steps that are exposing our public so even greater risk than protecting them. We had more than 30,000 cases in UK yesterday. Our health minister has admitted it's very likely that we'll see 100,000 daily cases over the summer. Even if 1% of these go to hospital, that would mean 1,000 people admitted to hospital every day. This will mean horrific suffering for those affected, and we should take all possible steps to avoid as far as possible. But if we don't, how will we manage the demand this will place on the health service? What will we have to sacrifice to meet these needs who will lose out? We will further deplete our frontline workers who are already exhausted by 2 devastating waves that have been a direct result of the delayed response in controlling the pandemic. How can we protect our precious workforce? All these will be immediate effects, but there will be great longer-term impacts on those affected by COVID-19 and those whose care has been disrupted because of the demand of COVID-19. And the impact of these government policies will disproportionately affect disadvantaged groups. And you all know Sir Michael Marmot report shows us that the fall in life expectancy due to COVID has been much greater in some regions, leading to even greater health inequalities. My Greater Manchester is an example of that. Worryingly, we are seeing more and more younger people needing care. Our long COVID clinics are filling up with thousands of referrals, but prioritizing emergency care over the second wave has meant that many who have suffered the consequences of government failure to control the pandemic are waiting for care, even as our government once again pursues a policy that will produce hundreds of thousands of needing care. To conclude that, government has actively chosen to pursue a policy that will result in mass infection, huge levels of sickness and hospitalization again, especially when we are close to achieving sufficient vaccine coverage in a matter of weeks. This is completely unjustifiable and wrong. Government must act urgently to protect our public and our NHS. I fear that the lessons are still not being learned by a government that is driving policies on basis of economy rather than lives affected by the pandemic. They forget that economy and health go hand in hand. Thank you very much.
Thank you very much indeed, Kailash. And finally, then we'll hear from Dr. Deepti Gurdasani, clinical epidemiologist at Queen Mary University of London, who brought this group together for the letter and for this summit this morning. Deepti, over to you.
Thanks, Alice. I want to start by telling you why we're here today and how we came to be here. In October last year, almost 7,000 scientists signed the John Snow Memorandum, which was a scientific consensus on what we knew about COVID at the time. In the John Snow memo, we laid out the dangers of pursuing a herd immunity strategy through natural infection. This was necessary at the time because this dangerous and unethical strategy was being actively promoted by influential advocates and interest groups who went on to advise governments, including our own, asking government to delay acting in September last year, which we know now led to tens of thousands of deaths. Everything we knew then still stands. And now that we have safe and effective vaccines against this virus, pursuing herd immunity through infection is all the more unjustifiable. We are well into the third wave with the more transmissible Delta variant. Cases and hospitalizations are rising, and only half of our population are fully vaccinated. Over 21 million people who haven't been vaccinated at all, and these are predominantly young people, including children. At this point, our government has decided to abandon almost all mitigations. This is essentially letting the pandemic rip through the unvaccinated and is effectively herd immunity through infection. As Dr. Horton outlined so elegantly, we are now creating hundreds of thousands more with long COVID-related chronic illness. Our Chief Medical Officer, Professor Chris Whitty, has made clear a few days ago that we will see much more long COVID, particularly in the young, and that it is critical that we keep transmission down and vaccinate everyone. Our government knows the risks and fully anticipates that things will get worse, and by removing the little it is still doing to prevent this, it is effectively pursuing this disaster scenario and doing nothing to prevent it. This will create a generation blighted by a disease from a virus they could have been vaccinated against in just a matter of the coming weeks. But the effects of this will be felt for years to come, and as usual, they will disproportionately be felt by the already disadvantaged. And don't just listen to me. As Dr. Horton outlined, Dr. Mike Ryan at the WHO just a few days ago urged extreme caution on the removal of all COVID restrictions, even in countries with relatively high rates of vaccination. And when he was asked about the UK strategy, he stated that the logic of allowing more people to be infected has already been shown to be, in quotes, moral emptiness and epidemiological stupidity. This government strategy is callous and inhumane. The government has completely abdicated its responsibility to the public and made protecting ourselves a personal responsibility. To the Prime Minister, I ask, how is a parent to protect their clinically vulnerable child who won't be offered a vaccine and is forced into crowded, unventilated classrooms without masks or distancing or bubbles? How does an unvaccinated or clinically vulnerable person who may not have sufficient immunity from vaccines going into work protect themselves when traveling on crowded buses and tubes where masks are no longer required? The government has a responsibility to protect the public, but also to protect, to not worsen the pandemic in the rest of the world, especially those countries with poor vaccine coverage. Failing to get on top of the pandemic during our second wave spawned a new variant that not only devastated the UK, but also spread across Europe, leading to hundreds of thousands of deaths globally. The dangerous experiment we are all being herded into has huge potential to lead to new and dangerous variants that could escape vaccines even more and have massive impacts, not just in the UK, but globally. How can we accept this as a society, that our children and young are being actively exposed to an infection which causes long-term disease we don't even fully understand or know how to treat, when they could be protected through mitigations in classrooms like so many other countries have done, when they could be vaccinated like millions of adolescents have across the globe? Why should we doom a generation to the impacts of a novel virus when we can protect them and vaccinate them? And while countries like Israel, with much higher rates of full vaccination than us, are now taking urgent action to reintroduce masks and vaccinate children, we're dooming a generation to the impacts of a novel virus rather than safe and effective vaccines. We can't accept this, and that's exactly why we are here today. Since the Jon Snow memo, many of us have kept fighting for a better and more sensible pandemic strategy, fighting to make schools safer, fighting for the government to look after its people. It's been incredibly hard and has often felt futile as the government has steadily removed protections and promoted policies of mass infection. But this latest step is far worse. It's effectively giving up on trying to control the pandemic at all when half of our population is not fully protected from vaccines. And that's completely unacceptable, and we can't let it pass without fighting back. The world is watching us. Our children are watching us, even if they cannot comprehend what they are seeing. We must not accept a policy of mass infection and mass suffering. We need to fight for our government to protect its people, protect our young, and protect their futures. Please join us in our call to government to stop recklessly endangering our young and take urgent action to protect them. We have been asking for the last year for the government to take controlling transmission seriously, for them to develop a border policy, for them to fix, test, trace, and isolate, for them to make schools safer, all of which could have been done and has been done across the world. But none of this happened, and it's not for lack of advice or money. And now the least the government could do is not lift all restrictions on the 19th. We could so easily hold out for a few weeks more till we've managed to vaccinate and protect many more people. It is tragic that we have been failed so badly by our government, where we are in this dire position of urging them not to undo the bare minimum that they're doing right now. And that's it from me. Thank you, Alice.
Deepti, thank you so much for that. I think it's very clear how serious this situation now is. We are now going to take a couple of questions, and when we've handled some of those, we're then going to ask some of the MPs who've assembled with us here this morning to respond briefly. So members of the press, if you'd like to ask a question, please could you message Joanne in the chat? And I have a question here. Well, our first questioner is going to be Graham Lawton from New Scientist. Graham, are you there and able to ask your question?
I am, thank you. I think it's unarguable, as a couple of speakers have pointed out, that essentially encouraging the transmission of the virus risks the evolution of these new variants that can escape vaccination or natural immunity. But my question is, so has the virus kind of explored all its phenotypic options at this point, or could it still mutate to become even more dangerous?
Thank you very much for that question. Who would like to start with that one? Deepti.
I can try and answer that. I think it's extremely unlikely. And the reason why I say that is the virus is evolving constantly. And how we know that is because we have very, very good surveillance in the UK, and we are surveilling different sequences that are emerging right now. And even as we talk about the Delta variant as a single variant, there are mutations developing on the Delta variant. So there are actually many different versions of the Delta variant with mutations on top of them that are similar to, for example, the Beta variant or the so-called South Africa variant, and several other mutations that we've seen in other variants under investigation or variants of concern. And that's what is convergent evolution. So we are seeing the same mutations emerge again and again. And we are seeing evolution right now in front of us in the UK. Within the UK, we have many new mutations that are being monitored. And there's absolutely no evidence to suggest that this is the end of the line. There's so many combinations of mutations, and every 3 months or so, or even in less time periods, we've seen new variants emerge that are more transmissible, more severe, more likely to escape vaccines. And there's absolutely no reason to think that this will not happen again unless we prevent transmission, because that's the only way of preventing adaptation.
Thank you, Deepti. Would anybody else like to talk about this issue of new variants arising, or do we think we've covered that? I can't see anybody desperate to jump in there. That was very comprehensive. Thank you very much, Deepti.
Yeah, thank you very much.
We have a question from the public here. In your experience, are hospitals already struggling to cope? And can you talk about how NHS staff are reacting to this latest news? And this one is directed to Dr. Rachel Clarke, who joins us this morning. She is an NHS palliative care doctor and an author. Rachel, could you answer that question, please? Are hospitals already struggling?
Yes, I'm afraid they absolutely are. So at the moment, and this is of course even before the mass relaxation that's planned for 10 days' time, we're as overstretched as we've ever been. A lot of A&E departments all over the country are reporting record-breaking attendances. So they are seeing more patients in a 24-hour period in A&E than they have ever recorded in their whole history. That's happening now. Yesterday, a very big teaching hospital in Leeds had to cancel some of their major cancer surgeries. Literally on the day of operation, these patients were told, we can't do your operations because there are no intensive care beds for you to go to post-operatively because they're filled with COVID patients. And this is absolutely awful. The bottom line is, there's only a finite number of staff, and we are desperate to be addressing the terrible backlog of work that needs to be done. There are over 5 million patients waiting for surgery, for instance, now in the UK. But our ability to do that is fundamentally constrained by how much COVID is being transmitted through the country. Every patient with COVID being treated in an NHS hospital takes nurses and doctors and other healthcare professionals away from addressing the needs of all the non-COVID patients. So as far as we can tell, this policy of permitting up to 100,000 new cases of COVID a day is absolutely harmful to all patients, whether they are suffering from cancer, heart disease, a brain hemorrhage, a car crash, or COVID. We want to be doing the best we can for all those patients, but the more COVID is being transmitted, the more those COVID patients inevitably take up a finite workforce, and the less we're able to help everybody else. So from our point of view, it is helping all vulnerable patients that makes us so desperately worried about this plan. And I think I'm speaking on behalf of patients when I say patients by and large are vulnerable members of society. They don't always have a lot of power or voice or status or clout, and they are not being heard. The vulnerable people are elderly, are immunosuppressed, all the clinically extremely vulnerable people who see so-called Freedom Day not as freedom, but as oppression, because it means they're terrified of being infected with a disease that could now kill them, are not being heard. And Sajid Javid, the new health secretary, he's not mentioning them. It's as if they don't exist in his mind. And as a doctor who cares fundamentally about vulnerable patients, I find that abhorrent.
Thank you very much indeed, Rachel. Kailash, I was going to ask if you wanted to contribute here as well. And you're muted again, Kailash.
Thank you. I think I agree with every word Rachel has said. The truth is, NHS is not at a breaking point. It's broken. Just go back, even before the pandemic, the workforce crisis, I think, is a massive, massive thing for the policymaker to look at it. We were 100,000 staff short before the pandemic, and the situation is getting worse. Since 2008-9, would you believe it? I think people will be shocked. 21% of doctors have left NHS. And survey after survey, BMA has found out that almost 72% people are thinking of early retirement. People are exhausted. Most of the mental illnesses now are affecting the doctors. Quite a few doctors who are off sick, they are off sick because of mental illness. So unless we really look into the workforce crisis, I think we are literally in a very, very dark place. And NHS, in my view, is being run by the goodwill of the staff, not by the policies of this government. So we have to really look into it, how we really, for the future. Otherwise, NHS is gone. And NHS once gone is gone for good. And I'm really concerned about this NHS reform bill coming in the parliament, which is already being debated, will further, in a way, weaken the professionalism of the medicine.
Kailash, thank you very much. We're going to take another press question now before I move on to invite some of the MPs to respond. We have Natalie Grover from The Guardian. Natalie, what's your question?
Hi, thanks so much for doing this, and really appreciate everybody being here this morning. I think all of the arguments and sort of assertions you've made about the current situation make perfect sense. I just wanted to, I guess, ask you about some of the comments from Chris Whitty from recent days. He mentioned, and I think this is built on some of the modeling from Imperial College, that opening up now in some ways might be better than opening up in the autumn, because it would just be sort of delaying deaths. And I was wondering if you could comment on that. Obviously, it doesn't seem like these models have taken into account the issue of long COVID and sort of all the morbidity associated with this, but just on hospitalizations and deaths, if you could just help us understand why that comment was made by Chris Whitty.
Thank you very much, Natalie, for that question. And Deepti, it looks like you would be keen to answer this.
Sure. I mean, I was very puzzled by that comment too, because, it's common sense that obviously if you open up later, you can vaccinate more people, rather than allowing mass infection now. And I couldn't see how that would make the situation worse over winter if we open up later. But looking at all the models that the government seems to be relying on, the Imperial model actually did suggest that a delayed reopening might worsen possibly the number of deaths in over winter. But the reason for that is not the one that's been given by government. It's essentially because we've imported a variant that unfortunately has a level of escape against vaccines. And that means that the duration of immunity is likely to be lower, particularly in the elderly, than it would have been before we imported this variant. So we're expecting that some people who were vaccinated early on will have waning immunity and will lose protection over the winter. Also, given that our policy is currently not to vaccinate children, it means that when schools open in September, infection rates will rise because we don't have any mitigations in schools. And that, combined with the fact that we have a new cohort of vulnerable people because they haven't been given booster doses, may lead to increased deaths over winter. The thing is that both of these can be prevented by, one, having a plan for booster doses for people by reducing transmission, putting in mitigation schools, and vaccinating children, which obviously wasn't part of this model. So I think it's created a sort of false framing and false dichotomy. Certainly waiting is better because we can vaccinate and protect more people, but we can do that alongside protecting children and giving vaccinations to the ones who are most vulnerable, which will almost definitely have a better outcome than creating this level of mass infection right now when only 50% of our population are fully protected.
Does anybody else want to comment on this timing of unlocking before I move on to the next question? Okay, I'm going to move on. Thank you very much for that question, Natalie. I'm going to move on to Joe Pinkston from the Daily Telegraph. Joe, what's your question?
Hi, yeah, thank you very much. July 19th, it seems, is universally accepted in this chat as a terrible idea. I wanted to go back to the idea of data, not dates, the now infamous phrase that was used. What sort of data would you like to see, whatever that may be, hospitalizations, vaccines, etc., for an unlocking to happen at some point?
Thank you very much for that question, Joe. So how do we need the data to change for this full unlocking? Who would like to take that? Rachel, Dr. Rachel Clarke, and then Dr. Richard Horton.
Well, I think one of the things that is conspicuous by its absence this week is precisely that, the data. We know that modelling exists for both the numbers of deaths that are projected for this summer and also the number of hospitalizations. And yet, when both Sajid Javid and Boris Johnson were asked for that modelling, they declined to provide it to the public. So first and foremost, if I'm being asked to make judgments regarding my personal responsibility from the 19th of July, I don't want to do that in the dark. I want to see the modelling, I want to see the data. And at the moment, it seems as though not only is the political decision about the 19th of July being based on a date, not data, and certainly not on the science, it seems as though now the government is actively suppressing the science. They are not providing us with the modelling that would enable everybody to either feel comfortable or not with the planned loosening of restrictions for the 19th. So I want to see the government's modelling.
Thank you very much, Rachel. Richard, over to you.
Yeah, thanks. It's an important question because those who have criticised us for making these points suggest that we don't want to lift mandates at all, and we've got some atrocious commitment to a nanny state. That's not true. What I would want to see is a rise in vaccination rates to well over 70%, vaccination percentages across the country to well over 70%. And if we get to that point, then I think we're in a very good place to start releasing some of the mandates while still recommending the importance of mask wearing and physical distancing in certain situations, such as close contact, crowded spaces, and so on. Those 3 C's are really important for people to still adhere to. But the focus has to be vaccination rates. And my worry about July the 19th in relation to vaccination rates, and we're seeing this now, is that not unreasonably, many people who are not vaccinated are thinking, well, freedom is upon us. We don't have to worry anymore. And therefore, the pressure to get vaccinated is lifted. And that, I think, is contributing to the precipitate drop in the numbers of young people who are going to get vaccinated. And what we should be doing is not have July the 19th, accelerate vaccination, combat vaccine hesitancy, so we get those numbers up another 20 percentage points.
Thank you very much, Richard. And I wonder if I could just elaborate on that and pick up something from Joe's question, I think, and also returning to some of the comments that you and Trish made earlier. There does seem to be a complete omission of any discussion around other mitigations. It all seems to be about personal protection and these restrictions, and we just don't seem to be hearing anything about any other mitigations. For instance, the idea of ventilation in schools, which just seems to be completely omitted from any discussions. So I wonder if I could come back to you about other mitigations, Richard or Trish.
Yeah, I mean, we should have a look at Belgium, actually, because they've put in requirements for businesses to actually measure the levels of carbon dioxide in the building, which is a kind of proxy measure for the amount of air that's being shared, because we breathe out carbon dioxide. So I think that's a way that we should be going, is to look at ventilation. But I suppose the other thing I wanted to throw in is this idea of the mask as a symbol of loss of freedom, because actually I think we should be thinking of masking as a symbol of freedom. If I'm wearing a mask and everyone else is wearing a mask, then I'd be prepared to get on a train, I'd be prepared to go to a meeting in the office, I'd be prepared to go into a supermarket. But if we're all unmasked, we're actually less free, because anybody who's vulnerable, anybody who's concerned can't go into that shop, they can't go to a cinema. And I think if we can turn upside down this link between masks and freedom, the other thing is the economic benefits of masking could be huge, because if they reduce the number of people who are off sick from work, if they increase the number of people going out and shopping and spending their money and going back into, quote, normal life, unquote, then those masks are going to benefit the economy. So the idea that getting rid of masks is going to benefit the economy, I predict the opposite will happen.
Thank you very much, Trish. Richard, I wondered if you wanted to add anything to that. No, but Susan, did I see your hand up? Can I bring in Professor Susan Michie, who is Professor of Health Psychology at UCL and member of Independent SAGE as well. Susan.
Thank you. I wanted to pick up on this issue about the narrative of freedom, personal responsibility, individual choice. What we've seen throughout this pandemic is the huge inequalities in terms of the situations where people are living, the situations where people are working, and the levels of illness and death in different populations. And we are completely reliant as a society on people who are working in transport, working in shops, working in health and social care, collecting our rubbish, everything. Those people are being put into situations that are already risky before July the 19th. And what we're saying to them, all these people rely on who don't have individual choice, who are having to work in unsafe settings, that they have to, as a result of other people's individual choice, have to put their own lives in danger. And I think what the narrative does is very dangerous, because it really undermines what has been a strength of the narrative, certainly in the early parts of this pandemic, which was that we are all in this together. This is a collective effort. And that's patently true, because one person's behaviour or infectedness influences another. And my other real concern is that just by handing everything over to individuals and not taking responsibility for all the kind of mitigations that others have talked about, it will sow division. And again, in this country, unlike, for example, in the States, we've managed to avoid that to a large extent. But suddenly we're going to have one group of people, and actually the polls have shown it's probably the majority of people who are going to carry on wearing face coverings in indoor spaces, keeping distance where there's a risky situation, but a large section who are not. And this is potentially very divisive between people who think one group are being selfish and others thinking the other group are being neurotic, when we absolutely need to come together at this very dangerous point in time. So I think the whole narrative, as well as all the policies, needs to urgently change.
Thank you very much, Susan. I've got a question here to read out from Barbara Kohlmeyer, who is a senior editor and reporter at the Wall Street Journal. How do individuals safely travel to other countries, even if they are double vaccinated? Is there a safe travel option? Should borders be closed? Should we have closed borders? Who would like to take that particular question? So David King, I was wondering if that might be one for you. This is about border policy and travel and the danger of exporting and importing variants.
We do understand that we in Britain have suffered terribly from having leaky borders. We had virtually no control for a very long period of time. The Delta variant became rife in this country, and that was entirely due to a long delay in closing our borders to people from India, which really needs explanation. We've seen a vast number of people going down with the pandemic. I think the whole border situation needs very close examination. It does seem to me that we need to be extraordinarily careful. For example, will families be able to travel from Britain to other countries? Will they allow families to travel with children who probably have a high risk of carrying the new Delta variant with them and hence spreading it to these other countries? It would be, I think, unwise of other countries to accept that situation. So we have restricted travel capabilities, which I think the government is beginning to clarify, but it simply concerns me that this hasn't been on the radar for so long. And this is one of the issues that has led us into this really dire situation where the virus is so rife across the whole country.
Thank you very much indeed, Sir David. I am now going to give some of the MPs who have joined us this morning a chance to give their very brief response to what we've heard, and also to ask a question of the panel of scientists and doctors assembled here if they'd like to. So first of all, Caroline Lucas, who is MP leader of the Green Party of England and Wales. Caroline, over to you.
Thank you so much. A former leader, but that's fine. Thank you so much to all of the scientists and medics here for coordinating this vital letter and this press conference. And I guess what I just simply wanted to say is that many MPs do share your concerns, and we raise them on a daily basis in the chamber. And it's completely clear when we do that ministers have no answers to the concerns we raise. And in parenthesis, in a sense, I just want to say that I think it's demonstrated more than ever this last 18 months that our political system is broken, because ministers get away with lying with impunity, choosing not to answer questions, and this way in which MPs are prevented from holding the government and the Prime Minister to account, I think, is putting our democracy as well as our public health at serious risk. I just wanted to assure you that many of us are working, for example, on the APPG for coronavirus, where we're calling for a COVID suppression strategy, precisely focusing on some of the basic public health measures that this government has failed to take seriously right from the start. Why hasn't the government taken ventilation more seriously? I was struck by the fact that in New York State, there's a public website you can go to that gives the ventilation status for every classroom in that state. You know, why do we still not have a functioning test, trace and isolate system when we know that people won't self-isolate if they can't afford to? You know, where was the support that's given in other countries to people in crowded homes, for example? Why didn't we have a stronger border policy? There are so many points to raise. I appreciate time is short. So I just want to say two things. First, I really appreciate the way that your session this morning has challenged this idea of freedom, because one person's Freedom Day is another person's lack of freedom to be able to do some of the basic things because they haven't been vaccinated or because they are immunosuppressed. We don't allow people to drive down a motorway at 100 miles an hour because of risks to others. Why aren't we applying that same logic when it comes to COVID? And my question is about long COVID. The government just seems to be willing to inflict long COVID on so many people. I wonder if you have any thoughts about why it's not taking long COVID more seriously. We saw that 385,000 people have been living with it for a year or more. It can be deeply debilitating. Do we need to just be getting more data on it to put in front of the government? What is it going to take for the government to take long COVID more seriously?
Thank you very much, Caroline. There does seem to be this focus on mortality and acute morbidity and not thinking about the longer term health effects. Trish Greenhalgh.
Yeah, my team's been doing research into the lived experience of long COVID. We've interviewed over 100 people who have symptoms beyond 12 weeks following an acute COVID infection. And I can confirm that this is a real disease. It causes real suffering. And one of the things it leads to, it affects every system in the body, but one of the things it leads to is what we call functional impairment. In other words, you can't do your job. With a lot of health professionals gone down with it because they were sort of in the front line to become infected. So doctors, nurses, porters, cleaners, people who work in the health service can't go back to work and do their jobs. There's a lot of them off sick with long COVID. But also jobs within the home. People can't look after their kids. They can't do their caring responsibilities. They can't, when they go shopping, they've got what they call brain fog, and they can't pick things off the shelves. They go home with half the stuff forgotten. You know, these really basic things that we need to function in our bodies and minds are affected by the long-term effects of this virus, which does affect something like 10% of people who get COVID. And you can argue about the precise numbers, but without a doubt, there is a heck of a lot of people. And again, I would encourage Sajid Javid to think about the economic implications of people being off sick for so long. We are developing a generation of people with chronic disability through no fault of their own.
Thank you very much indeed, Trish. And now I'd like to invite Richard Burgon, who is Labour MP for Leeds East, to respond and ask a question.
Thanks very much, Alice, and thanks particularly to Deepti for organising today's very important discussion. Just to echo what Caroline said about the response from the government, hearing Sajid Javid in the House of Commons chamber early this week, I thought was chilling how ideologically hardened this right-wing libertarian approach from him was. And something that struck me in particular was the venom with which he responded to Dr. Philippa Whitford from the SNP, who was putting forward very sensible, very reasonable and very educated points about public health protection. And his response was to somehow paint her and us as the extremists, rather than his approach being the extreme approach and this government's approach as being the extreme approach. It has been described, and I think it is, as an experiment, a dangerous experiment. So I think it's really important that we challenge this narrative of so-called freedom, because of course it's not freedom if it puts other people at risk in the way it is. I think we need to carry on pushing for sick pay at real living wage levels, which is something I've been pushing for, because otherwise what we're going to get is a further intensification of a situation where those who are most likely to be exposed to coronavirus are also those least likely to be able to afford to self-isolate. And so we're really then going to see it becoming more and more a disease of the poor in this country and the vulnerable. And if the government thinks that's acceptable, and it completely isn't, obviously we need to kick out Serco and the like from test and trace. I agree that we need to carry on asserting that masks need to be required unless there's a medical exemption in enclosed public spaces. And the majority of the public support that. So the government aren't responding to public pressure. The government are imposing this dangerous approach upon the public despite public opinion. I also think we need to be providing ventilation grants and, of course, offering vaccines to all teenagers, as is done in other countries. It's already been mentioned, the danger, hasn't it, of the escape from vaccine with an increased likelihood of dangerous mutations which get around the vaccine. It seems to me about the only thing that's been done well in this country has been the vaccine rollout, because the NHS has been and local health authorities have been in charge of that. And for all that good work to be put at risk by this reckless approach is completely indefensible in my view. And I think we need to understand, and I'll finish on this, that actually the public are with us on this sensible approach. The government tries to portray our view as somehow extreme or out of kilter. But I was looking at an opinion poll which showed the majority of the public not only believe that masks should be still in place in enclosed public spaces, but also that public health measures should continue. Public health measures should continue and not be completely removed. So I suppose the question I want to ask is, what hope does the panel have that we can secure the valuable changes and concessions needed from the government's extreme approach before the 19th of July?
Thank you very much, Richard. Who would like to respond to Richard's question there? I'm looking around the panel.
Well, can I?
Susan. Oh, Susan first, Professor Susan Michie, and then Dr. Richard Horton.
Only to say that there have been U-turns in the past. The first was delaying schools going back by 2 weeks, and that was as a result of pressure from scientists, along with teachers and the unions representing them, governing bodies, local authorities. So I think it's really important to think that where the scientific arguments and the data are supporting what's being said, and where there are events like this, so that the conversation can be widened out and a very wide range of people can understand what the implications of what's being proposed are and what the alternatives are that are very doable, then I think there's a potential of a really important alliance coming together. And I think we should think that it is possible still, even with our new health secretary, to achieve a U-turn on this one.
Thank you very much, Susan. Over to you, Richard.
Thanks, Alice. I'd like to be optimistic like Susan, but I'm less so. This word experiment that's been used is a very interesting word, because the word experiment starts off from assuming a position of uncertainty. You do something in order to make a discovery or test a hypothesis, but that's not what we're doing here. We know exactly what is going to happen by taking the course that the government has committed to. We know that there will be an increase in infections. That's not an experimental hypothesis to test. We know that hospitalizations are going up. We know that there will be an epidemic of long COVID, and we know that we're creating the risks for new variants. That is not in doubt. So what we have is a government that is pursuing an ideologically driven commitment to force the population to accept a level of mortality and disability in order to release us from the situation we're in currently. This has got nothing to do with data, nothing to do with experiments. This is ideology from the libertarian right. And I think until we confront that fact and explain that clearly to the public that this is not about data, that this is about ideology, then we're not understanding what this government is about. And it's a profound, and I have to say, it's a profound sadness to see people who I respect in many, many ways, such as Patrick Vallance and Chris Whitty, allowing themselves to stand next to a prime minister and give their apparent support to this appallingly politically driven position.
Thank you very much, Richard. And I would like to invite now Debbie Abrahams, who is Labour MP for Oldham East and Saddleworth, for a response.
Well, thank you so much, Alice, and thank you to Deepti and to all the health and scientists who have given their evidence today. I come from a perspective that we didn't need to be in this position. The government's handling of this pandemic has been absolutely atrocious. They haven't seemed to be learning the lessons at all as we have gone, as many of us have pointed out. I think in terms of what Caroline has said, in terms of this is an indictment on our political system, I think is absolutely right. And the opportunity to hold from yesterday, for example, where it was felt that there couldn't be a guarantee that there would be support on the government benches for extending public health regulations, and that was quite apparent given the challenge of the leadership of the 1922 committee. This is really serious. We needed to have a precautionary approach, and the government at all stages has failed this. And as a consequence, we've got the highest excess deaths in the OECD, the second highest in Europe. Yes, we've had a fantastic vaccination rollout, but that's down to our NHS staff, and we must be holding the government to account on this. It is about collective responsibility. We cannot escape this. And I think in terms of what has been spoken about in terms of the right way forward, I absolutely agree. It is totally unacceptable if we think in terms of, again, the disproportionate impact on poorer communities, on disabled people, on our Black ethnic minority, Asian ethnic minority communities. We cannot once again see this being allowed to rip through these communities with the long-term effects this is going to have. I was absolutely staggered by the response of Sajid Javid, again around Building Back Fairer, seemingly unaware in terms of what needs to happen there, and responding to not just Michael Marmot's COVID review, but also the Health Foundation's report that they published earlier this week, again showing the inequalities that are being exacerbated, and I fear will be continued to be exacerbated if we go along this route. So my question to the panel is, firstly, do they agree with that? Do they see the issues in terms of the impact on inequalities? And then what should we be doing about this, particularly thinking in relation to interventions in school? I think Richard's right. Once we reach over 70% in terms of vaccination rate, that will be an indication of a relaxation. But what should what should that look like? And as I say, particularly thinking about schools. And finally, can I just...
Oh, sorry, Debbie.
So just very, very briefly, I asked whether at the Work and Pension Select Committee yesterday, whether they had considered the impact of long COVID in terms of the support that was going to be needed through the social security system. And they said no. What does that say about this government? Thanks so much, Alice.
Thank you very much, Debbie, for those questions. And I can see that Trish would like to respond.
Yeah, I'm going to let someone else respond to the specific question about schools, because that's not my field, but just to point something out, which is, it's great to see MPs on this, because these findings have huge political implications. But I would just like to make the point that I'm in this as a scientist. I don't have a political agenda here. The facts about airborne transmission of this virus, the facts about who gets serious COVID, the facts about who is on intensive care, the facts about how much disability long COVID causes. These are scientific facts, not political facts. And I think we need to make these scientific facts freely available in peer-reviewed publications for those who work in politics to draw upon. But let's make it really clear that the points we were making in our Lancet letter are primarily scientific ones. I'm now going to hand over to someone else to answer Deborah's schools question.
Yes, if there is somebody here who could briefly speak to schools, Deepti.
Yeah, I'll keep it very brief. So, I mean, I do agree we need to get many, many more people vaccinated, like Dr. Horton said, more than 70%. The thing is, while adolescents are eligible for vaccination right now, the vaccines are being trialed in younger children and they're not eligible. And it's very important that you know, they're not completely left exposed to the virus when restrictions are lifted. So I think alongside increasing vaccination, we also need to protect those who are not eligible for vaccination. And this means having mass ventilation, smaller bubble sizes, rather than doing away with bubbles in schools, to actually minimize disruption while we keep schools open. The solution to raging pandemic in schools right now, and children having such high rates of infection, which will translate to high rates of long COVID, isn't to abandon the measures that are protecting them, like isolation, but rather to prevent the core reason why people need to isolate, children need to isolate, which is infection in schools. And it's very clear that many countries have done this and successfully kept schools open without having 650,000 children isolating. And we can do this too. And we need to do this regardless of vaccination for our long-term future for children.
Thank you very much, Deepti. And we are running up against it now, but we are going to get through these other questions and these other responses. So please be concise. Philippa Whitford, SNP MP for Central Ayrshire. Philippa, what's your response and possibly a question?
Thanks very much, Alice. Public Health Scotland have released a report showing that while the hospitalisation is much lower than we had before, it's down from 13% to 3%. If you're having 100,000 cases a day, you are talking about 3,000 admissions a day, which is what we had in the first wave. And therefore, we need to keep that in proportion. Sajid Javid talked about, well, opening up will allow everyone else who needs the NHS to get it. But it's the same NHS. So if it's overwhelmed with COVID, it can't be catching up the backlog. And I think we need to recognise that. There aren't spare NHSs around. As Richard highlighted on Monday in the COVID statement, I asked the two key questions. How do you prevent new UK generated variants like we saw last autumn that are more vaccine resistant if you've got 100,000 cases a day? And how do you prevent an epidemic of long COVID? And the response was just incredibly aggressive. I've never been responded to like that in the chamber in 6 years, with no attempt to answer those two key questions. And the other one is vulnerable people. People who had to shield last year are going to end up going back to that because they won't feel safe. And my question to the panel is, what do we see as the longer term things that we literally will need to do through next winter, even if we can ease others? You know, is it mask wearing? Is it still working from home? So what are the kind of medium term mitigations like ventilation that we have to just accept are here until the pandemic truly is over?
Thank you very much, Philippa, for that very pragmatic question. Who would like to take that? What should we be doing until the pandemic is over, rather than pretending that it's over already? So, David, did I see your hand up?
You did, yes. So let me just very quickly say, the missing parameter right since the beginning of this pandemic has been the normal process of dealing with a pandemic of this kind, whether it's in animals or human beings, which is to find, test, trace, isolate, and support those who need to be isolated. And the government decided only in May to pass this over to some newly formed private companies to run. We have never got to the point of isolating all those who've gone down with the disease and those who've been in contact with them, even though in the late August, we should have been aiming for that because we were down in the hundreds of new cases across the whole country per day. So it was a perfectly easy target to go for, but it just seemed as if they had lost that target. I do think that is the right way out of this.
Thank you very much indeed, Sir David. And I'd now like to invite Barbara Keeley, who's also joined us this morning, Labour MP for Worsley and Eccles South. Barbara.
Thank you. And thanks to Deepti and thanks to all the scientists and those who've organised the call this morning. I want to say first, I do agree that the government is moving too broadly and too fast, and that doing that when infections are rising rapidly is reckless, and it shows an impact, a disregard for the impact of the virus. I'm a member of the Health Select Committee, and with my colleagues here are also a member of the APPG on coronavirus. And, you know, my deep concern, given all the work we've done over the last year, 18 months, is the government strategy leading to this third peak in hospital admissions. But also, I don't think it's coming across, and it has come across very well today, how much that will impact on non-COVID services being impacted and cancer treatments being delayed and that leading to deaths. I'm also deeply, deeply concerned that our NHS staff are completely burned out, as Kailash Chand has said, and our care system is broken. We're not in a place to cope with very high levels of infection and hospital admissions and illness because of those factors. And this week I talked to at length to a vulnerable person with cancer who was immunosuppressed. And I think we can't emphasize enough this point that Freedom Day is not freedom for those people. As Philippa has just said, it really is not. And the person I talked to was just angry and sad and upset that after protecting himself and shielding for 18 months and then going through surgery and now currently chemotherapy for his cancer, he felt that he was not be able to go out of his home at all, really. And I think the other point too is a point that a couple of my colleagues have made about what level of vaccinations we need to reach. Richard Horton talked about reaching 70% vaccinated before lifting restrictions. In Salford, we've got much lower vaccination rates. We've only reached 46% with second doses, and yet don't let's think that there's a massive supply and that we could have dealt with this. For weeks, I've been asking questions of ministers of why our supply of vaccine has been so cut. 1 week, we only had 2,200 doses. Now in Salford, as in the Northwest, but in Salford in particular, we've been running for a number of weeks, 300, 400 cases per 100,000. And yet 1 week, we only had 2,000 doses. So our vaccine rollout is limited, so that it's even more reckless to go ahead in this way at this point where our vaccine supply has been so limited. So I want to focus back on the vulnerable and the immunosuppressed, and my question is about them. Are we just pushing those people into shielding, and do we have any idea how many there are? Because it seems to me, if we stress that it's not okay to accept 10% of people having long COVID, it's not okay to accept the deaths of people with underlying health conditions, and it's not okay to accept pushing millions of people back into shielding.
Thank you very much, Barbara. I mean, do we have an idea of numbers? Do we have an idea of the proportion of the population that we're talking about here? Also, of course, being aware that we don't know everybody who is going to be vulnerable to COVID. Some people will already have underlying and detected conditions which make them more vulnerable, but there will be vulnerabilities that are undetected as yet. I wonder if Kailash or Richard could speak to this. Kailash, would you like to respond to Barbara? Sorry, Kailash, would you like to respond here?
I think let Richard go first, and I will follow him up.
No, I don't have anything to add to what Barbara said.
I mean, Barbara, you did kind of encapsulate the issue very well, actually in your question. I suppose we know that there is there will be a large fallout from that, and we've heard about that quite a lot. I'm going to have to move on, I'm afraid, because we are up against it time-wise. But thank you very much for that, Barbara. I'm going to invite a question now from Clive Cookson, who is the science editor of the Financial Times. Clive, over to you.
Thanks all. There's been a lot of chat about why it's so politically polarized, this issue that should be a bipartisan or tripartisan issue. Why are there no Conservatives willing to join this? How much support is there within some wings of the Conservative Party for the sort of things you're saying? How can we heal the political divisions rather than, as some of the Labour MPs are doing, just exacerbating them with insults against Sajid Javid, which I agree with, but I don't think they're very helpful. Thank you.
Thank you very much, Clive. Richard, you would like to respond here?
Yeah, Clive, I think you've asked a really important question here. And I think actually the debate that we're having right now in a way returns us to one of the fundamental divides in politics. And that is this divide between liberty and equality, as if they're two opposite sides of a coin, and you have to sign up to one or you sign up to the other. And we're seeing this debate now around personal responsibility and hearing about Sajid Javid's reading of Ayn Rand and Fountainhead and all of this. I mean, the truth from a public health perspective, just coming back to the science, is that we shouldn't be pitting personal responsibility against the collective or against social determinants of health or against addressing inequality. The fact is, you need both. We do need to address the causes of inequalities that have afflicted our communities and made them vulnerable, exquisitely vulnerable to the ravages of coronavirus. And unless, to answer Philippa's question over what do we do over the next 2 years, unless we improve the overall health of the population, unless we address inequalities and see those as part of pandemic preparedness, we will not be prepared for the future. But that is not to say that we do not also have personal responsibility. We should be wearing masks, for example, as Trish said, symbolic of our commitment to freedom, and also as symbolic of our commitment to one another, that I am responsible for your health just as you are responsible for my health. So how do we get through this division, Clive? I think it is to say that we need a combination of personal responsibility and a commitment to our communities, our overall society, by addressing these social determinants of health, and not allow ourselves to fall into one side or the other, because that, again, misunderstands the science.
Thank you very much indeed, Richard. A question now from Claire Hasty, who is founder of Long COVID Support. Claire, please keep it short. Thank you.
I will do. I'll probably say it as a statement rather than a question, actually. I myself and two of my children have been living with long COVID for 16 months so far. We don't know if and when we'll get better. The Facebook group I started has over 40,000 members in it, so I see day in, day out what it can do to people. We have measures in place in law to protect people from the dangers of passive smoking, so I don't understand what possible justification there can be for exposing our children to the virus in classrooms without mitigations in place, in workplaces, in leisure facilities, on public transport, and particularly in schools where they have no choice but to attend. The REACT-2 study indicates that between 30 and 40% of cases lead to long COVID of 12 weeks plus. So this is a huge issue, and I think we need recourse in law.
Thank you very much indeed, Claire. And if I could just squeeze in one last question, which has come in from Tom Whipple at the Times, He says, these arguments all make sense, but it feels to me like there's a bit missing. We are already in a huge wave. Even without the 19th, it will get massive. Why are you not arguing for a re-imposition of restrictions? And could I broaden that out to wider mitigations as well, and not just restrictions? Who would like to take that question on possible reintroduction of restrictions? Deepti.
Yeah, I'm kind of puzzled by that question, because we've been arguing day in and day out for this. Our letter also argues for this. Yes, it's certainly not sufficient to just pause 19th of July. We are in a crisis right now. We have a pandemic that's doubling every 9 days, even now. You know, cases doubling every 9 days, even now, with hospitalizations rising. The impact of the rises over the last 10 to 15 days haven't even been felt yet. And we've been arguing for essentially stronger mitigations in classrooms, which would help contain some of this, which is masks, social distancing, reintroduction of bubbles, ventilation. And ventilation is not restrictions. I mean, we really need the media to stop thinking in terms of lockdowns versus opening up, restrictions versus no restrictions. There are measures to contain this that many countries have put in, like focus on aerosol transmission, ventilation. Masks are a minor inconvenience. Good test, trace, isolate systems, manage quarantines at border. I mean, everything doesn't involve a lockdown, but these are measures that have a huge impact in containing spread and actually prevent us needing restrictions. Most of Southeast Asia actually did not need national lockdowns or prolonged national lockdowns to contain this, because they had all those measures in place. We're not arguing for lockdowns here. What we are arguing for is preventing them, because how you get to a lockdown is not taking action with all the things that I mentioned early on. And that's where we're headed. You know, so this is not saying that we need to go into restrictions, but rather we need to prevent prolonged lockdowns by taking aggressive action early. And to be honest, it's already very late.
Deepti, that is a brilliant summary. Thank you very much. Right, we're going to have to leave it there. Thank you to everybody who has assembled here this morning. Thank you to the panel of scientists. Thank you to the MPs that have joined us. And thank you to all the press for your questions, and to all members of the public that have been sending questions in as well, and anyone watching. Please join us to call on the government to act urgently. Our letter is published in the Lancet today. Mass infection is not an option. We must do more to protect our young. And you can sign the letter. Scientists and healthcare workers can sign the letter on the John Snow Memorandum website. Please do anything you can. Please write to your MPs, sign petitions, make your outrage known. And I think all the scientists and doctors here are on social media, and it's probably easiest to find us all on Twitter. Many of us have been sharing the links to the Lancet letter this morning, including, of course, Deepti Gurdasani, who just summarised so brilliantly there and who brought this group together. Our government isn't protecting us, so it's up to us to do whatever we can to protect each other. Stay safe, keep well. Thank you.
And thank you.
Bye.